Hi, I'm Dr. Harbir Singh, live here at the Digital Health Summit studio here at CES 2020. I'm here today with Charlie O'Connell, CEO and founder of GlucoZone. Charlie, it's fantastic to have you here.
Thank you. I'm happy to be here. This is awesome opportunity to collaborate and be a part of this exciting industry.
Yeah, absolutely. So, tell us a little bit about GlucoZone.
Yeah, so GlucoZone is a digital therapy for diabetes. We're pioneering the prescription of apps instead of drugs for diabetes. And really what our mission is related to is there's a public health crisis happening right now as relates to diabetes. And the reality for patients is the standard of care is not working.
Right.
And we think that the disruption and the innovation that is needed in the standard of care is in the non-pharmaceutical aspects of the standard of care.
So that's absolutely fascinating. So you're focused on not using pharmaceuticals to make an impact in diabetes care.
Well, very specifically for clinical outcomes.
For clinical outcomes.
Yeah.
Okay. So how did you end up founding GlucoZone? What's the story here?
Yeah, so I'm a patient entrepreneur. I have type 1 diabetes myself. I've had type 1 for 23 years. I was really my own personal frustration with the lack of guidance and support available to me that motivated me ultimately to start the company. Very early on in the process, something became clear to me, and what became clear was this is not a me problem. These issues that I'm having are not just my own issues. This is a we problem, and that patients living with diabetes around the world really do need more support in these specific gaps in the standard of care that exist.
That's interesting. That's absolutely fantastic that you took something that was, an issue that you were dealing with and realizing that it's a larger problem and came up with a solution.
Yeah.
So, can you give us a specific example of how GlucoZone works and how it might help somebody?
So everybody knows that exercise is good for diabetes. Okay.
Absolutely.
What's not as clear or nearly as supported is the fact that exercise is different for people with diabetes, starting with the need to test blood sugar and manage medication.
Okay.
Depending on what a person's blood sugar level is, it may or may not be safe to exercise, may or may not be safe to perform certain types of exercise. And when you start to factor in medication profiles, types of diabetes, fitness preferences, comorbid conditions, even things like the weather, what becomes clear is that you can't just tell somebody with diabetes to go for a walk. It's actually a pretty complicated scenario every single time somebody with diabetes attempts to do exercise. What we have found is that when you support patients with diabetes with information based on their real-time blood sugar and other relevant biometrics, you can actually prescribe an exercise therapy to actually reduce their A1C. And that is ultimately the clinical outcome that GlucoZone has now been validated several times to help patients to achieve. And it's our mission to basically really challenge the standard of care that, you can prescribe an app instead of a drug to help patients in a clinically relevant way.
Wow. So you're taking real-time data of a patient's current state and using that information to give feedback to the patient in this situation, for example, whether to exercise or not, or helping craft a specific exercise strategy.
Yes,
and program
exactly.
for them.
Prescriptive advice based on their individual and personalized data in real time.
Wow. Well, Charlie, this is absolutely fantastic. I'm very excited to see what GlucoZone is doing and excited to see the progress you guys make over the next few years and see how we can make an impact in diabetes care.
Awesome, thank you, and I'm excited. I want to be encouraging to all the companies that are part of digital health that digital health is the future of healthcare. And I want to encourage everyone, change doesn't happen in 6 months, but it's very clear to me that 10 years from now, digital health will be the standard of care. And be encouraging to all the companies in this field to keep doing what you're doing. It's desperately needed. And as long as you're keeping patients at the forefront of your decision making, you're going to have success.
I couldn't have said it better, Charlie. Thank you so much for that positive message.
Yeah.
This is Dr. Harbir Singh live here at the Digital Health Summit studio here at CES 2020.